Welcome back, Voodoo Dolls, to another creepy video. This is part 2 of either 3 or 4 parts of my Anti-vaxxer series. This part is going to be talking about the different diseases themselves. So in part 1, I talked about what anti-vaxxers believe, how these myths were spread, and what vaccines are actually made of. So just a quick recap of the previous part because it's been a while. So I talked about how the anti-vaxxer movement spread. Basically, long story short, some guy made up a bunch of fake evidence, did a fake experiment, and only published the results that fitted his ideas. And as to what's actually in a vaccine, as far as metals go, mercury hasn't been used in vaccines since 1999. As for aluminum, there's only a fourth of a milligram, and that is how much aluminum is in all of the vaccines combined. So now we'll get into the actual diseases themselves, going in alphabetical order. So first one I want to start off with is chickenpox. Children are immunized against chickenpox at the age of 1 and again at 4 to 6 years of age. Chickenpox is characterized by a rash that starts on the stomach and then spreads throughout the whole body, including the face, neck, armpits, and genitals. The rash is characterized by large welts that can break open and leave the child covered in scabs. These open sores can become infected and lead to worse illnesses. Chickenpox can come back in older adults as shingles. Chickenpox is caused by a virus that is related to the herpes virus. So, think about what this means, right? So, parents who don't want to get their children vaccinated against chickenpox, not only is the child covered like head to toe in chickenpox already, like they're literally covered head to toe, like their scalp, their sensitive areas like armpits, and their genitals. Think about how painful that would be. And just so the child won't get chickenpox again in their life, I mean, why not just avoid the illness altogether by getting vaccinated? I mean, a vaccine works the same way as getting chickenpox, basically, except you don't get the full-on illness. You just get a tiny little dosage, not enough to actually make you sick, and that's it, nothing happens. And if your child goes around someone else who has chickenpox, there's a very good chance, like a 90% chance at least, that they won't get chickenpox. So next, we will talk about diphtheria. Children are vaccinated against diphtheria at the ages of 2 months, 4 months, 6 months, 15 months, and one last time at 6 years of age. Children are vaccinated against diphtheria many times in the first 6 years of their life. The first one starting at 2 months, next one at 4 months, next one at 6 months, next one at 15 months, and one last time at 6 years old. Children and the elderly are the most vulnerable to diphtheria. However, it is extremely rare in developed nations due to vaccines. Diphtheria is caused by a toxin that is released by a bacteria. It starts off with regular flu-like symptoms such as coughing, sneezing, headaches, sore throats. a mild fever. However, unlike similar bacterial infections such as strep throat, diphtheria toxins cause black or gray fuzz to line the mucous membranes in the throat and nose. The toxins that the bacteria produces can cause severe damage to the organs, and those who do not get treated have a 50% chance of dying. To get treated, a child or elderly person must go to a hospital and receive antibiotics, antitoxins, and a ventilator to help the patient breathe. The patient must be quarantined, and no one who is not immunized against the disease may visit the patient. The patient will need to be vaccinated after recovery to prevent reinfection. Hepatitis A and B. Children receive 2 shots for the hepatitis A and B vaccination. So they receive the first shot at 1 year old, and then the second shot is administered 6 months to 1 year later. Hepatitis A causes fever, vomiting, nausea, jaundice, which is also known as yellowing of the skin and eyes, and Hep A can spread through sex and through contact with fecal matter. A child can carry the hepatitis A virus for days or weeks without any symptoms and can spread it without symptoms, which is why vaccines are important, because a child could have it, not know that they have it, the parents wouldn't know that they had it, and the child could spread it on to vulnerable people. Children are vaccinated against the Hep B virus shortly after birth and at 2 months and at 1 year old. Hep B also spreads through sexual contact and contact with fecal matter. However, unlike with Hep A, someone who gets Hep B stays with it for life. Hep B can cause scarring of the liver cancer, and even death. Human papillovirus, otherwise known as genital warts or HPV. Most children are vaccinated against HPV at about 12. HPV can cause large or small warts to appear on the genitals. It can lead to cervical cancer in females and has been known to cause other types of cancers in both sexes. Similar to Hep B, once someone catches the HPV virus, they stay with it for life. And someone can pass the virus even if they don't have any warts on them. Measles. Children are vaccinated against measles twice through MMR vaccines, once at about 1 year old and again between the ages of 4 and 6. Measles is extremely contagious, and someone who is not immunized against it has a 90% chance of catching it just by being in the same room as an infected person. Measles causes a full body rash and flu-like symptoms. There are no treatments for it, and it can last for several weeks. Before the vaccine was available in the US, every year, over 500,000 cases were reported, and 500 people died, and 4,000 people developed encephalitis. Okay, the meningococcal vaccine protects against 4 different types of meningococcal bacteria, and it is given to children between the ages of 11 and 12. Meningitis can cause flu-like symptoms in the beginning, such as sore throats, fevers, headaches, body aches, and the like. But then, after a while, it causes irritability, sensitivity to light, skin rashes, and a stiffness in the neck. And if not treated immediately, meningitis can lead to death. In infants, it causes jaundice, stiffness of the body and neck, low temperature, a weak suck, and a high-pitched cry. Viral meningitis clears up over a few days on its own, but bacterial meningitis is deadly and it causes seizures. So the way meningitis works is that it infects the body and it infects the spinal fluids. And because it affects the spinal fluids, it causes swelling of the spinal nerves. And it is because of the swelling of the spinal nerves that the neck becomes stiff. And this can also lead to blood clots, which, if they move to the brain, can cause seizures and will eventually lead to death. And meningitis can also lead to swelling of the brain, which again can lead to seizures and will eventually lead to death if not treated immediately, which is why vaccines are extremely important. Mumps. Children are vaccinated against mumps when they receive their MMR vaccine at 1 year old and again at 6 years old. Mumps is a virus that travels through the saliva and infects many glands in the body. Most notably, it infects the parotoid glands, which produce spit. And these glands are located at the back of the jaw, so around here. And when a child is infected with mumps, the parotoid glands can swell, making the child look like their cheeks are stuffed with food. Mumps can cause inflammation of other organs, such as the stomach, liver, and even the brain, which can be deadly. In males, mumps can lead to inflammation of the testicles, and mumps is extremely contagious and passes through sneezes, coughs, and even laughter. There is no cure for mumps, and it lasts 10 to 12 days. But although there is no cure for mumps, the pain due to the swelling can be treated with ibuprofen. Thank you all for watching. Stay spooky.